Cardiopulmonary Resuscitation, Adult CPR. CPR is an emergency method consisting of chest compressions along with artificial ventilation. CPR is performed when there is a patient who is no longer responding and has either stopped breathing or their heart has been stopped. This procedure is used in hopes of restoring the circulation of oxygenated blood to vital organs such as your heart or your brain. If you are not yet trained, it is important to do something rather than nothing. Your hands could still save a life. If the person has been suffocated from a circumstance such as drowning, it is important to perform a minute's worth of chest compressions before dialing 911. If they still aren't responding after the minute is up, dial 911 and then continue the compressions until the EMT arrives. In all other cases, such as a car accident, of course dial 911 first and then proceed with the chest compression. Before CPR is even performed, it is important that you assess the situation. Is the person conscious? Ask if they are okay. A light shaking may be necessary if the person has just blacked out. Once you have declared that the person is unresponsive, dial 911. If an AED is readily available, deliver one shock and then check for a pulse or a sign of breathing. If the AED did not help, it is time to perform CPR. CPR can be broken down into what we call CAB. It stands for compression, airways, and breathing. Once you have completed all three, 1 rep of CPR has been completed. The goal of compressions is to restore blood circulation and to get the heart pumping again. First, be sure that the body is on a firm surface. You do not want to perform CPR on a water raft or in a car. Get on ground level. It may be necessary to knee down next to the unconscious body. Put the heel of your hand in the center of their chest directly between the breasts. Overlap your fingers and begin chest compressions. It may be more comfortable to interlock your fingers while doing so. It will add more pressure. Continue to push with your whole upper body strength, not just your arms, and do 30 compressions at a rate of 100 per minute, so fairly quickly. Once the 30 compressions have been completed, clear the airways. Gently place your palm on the forehead and tilt their head back, allowing the airways to be completely open. Tilt their chin up and slightly open their mouth. Check for a sign of normal breathing. This can be done by listening to their mouth or looking at their diaphragm area. If there is no sign of normal breathing, you have to breathe for them. With their airways open, pinch their nose, allowing no air to escape from there, and put your mouth over theirs. Create a seal so that the air cannot escape and is forced into their lungs. Give 1 breath and then check for signs of a rising chest. If the chest does not rise, give another. If they are still not breathing, begin the chest compressions again. If there is no sign of anything after 5 complete cycles of CPR, deliver another shock from the AED. Getting certified. If you are not certified already, I highly recommend you do so. It is never a bad investment to save someone's life. The Red Cross offers a hands-on and online training. Once you are trained, the certification can last for 2 years. Here's a website for more details on getting certified. Here are my sites, along with my notes that I took on every slide. I pretty much said exactly what I put here at the bottom. It was just a reference for myself to correctly verbally explain the information that I put on the slides, but not read the slides word for word. Thank you for watching. This was narrated by Danica Leffler.